presentations today topic about the importance of personal and professional development in the nursing practice. Before I go further, I would like to introduce my learning outcome that we will achieve today. Firstly, it's we will able to know the definitions of personal and professional development or PPD. Secondly, we're able to understand what the components contain in PPD. And thirdly, we able to know the benefits of PPD in the nursing practice and of course for our self development as well. So from the Oxford Dictionary, I took the definitions for PPD, which is personnel is also known as a person or individual, whereas professionals is relating to the workplace or special training, for example, in nursing, where need the continuous training or educations in order to be growth or changes and to become more advanced in the skills. That is also known as developments. So what are the benefits we will gain from the PPD? First, I'm able to maintain my high standard of nursing practice through the competent practice, the right practice for the patients. And all beside that, I'm able to identify my personal strength and also weaknesses. How to achieve all of this? So of course, the first approach that I will take is firstly to uh, to attain a specific training or advanced diploma or post basics for some period of time, for example, 6 months to 12 months. Secondly, go for the conference and meeting or even for online CNE or webinar. Why these all skills are important? First of all, it will make improve our ability and to improve our training and also get a new knowledge. And from the knowledge, we're able to gain a new learning process and make ourselves to be more competent through the training and experience. We able to become more competent in our skill and is also in our practice. So what the benefits we will learn today, there I mentioned four benefits here, which first one, we're able to improve our communication skills, which is one of the soft skills must be needed also in the nursing work in the nursing practice. And secondly, we're able to engage well in social skills. The social skills here is our patient and their family members. So beside of that, we're able to contribute a well-practiced skills in our team member and make us aware of our responsibility in our workplace. Why? Because in PPD, it teaches us to be patient, to have a vision. Through that, we're able to create an action. Then through the action, able to take a risk. Why we must take a risk? Because if we didn't try, we cannot reflect what the failure, what the success we get. So that from the failure, it's okay because we able to assess our progress. So that we inform our surrounding what makes how to improve the failure. So we listen and we observe, keep practice. So how, from there we able to know ourselves, and this circle it's keep cycling until we achieve and become more competent. And what the components I will touch today, there is four components I will mention here. First, communication skills, social skills, even team skills and responsibility in workplace. I will go detail on this slide. For the communication skill and social skills, what are they? They are interpersonal communication skill that will change our life. Why? It will create us as a personal that have a feeling, have an attitude, have empathy, and we become more positive in towards our workplace. And through that, if we have the communication skills, we able to communicate with the patients, with their family members. Instead of being sympathy, we able to apply empathy. So for example, in conflict resolutions in our workplace, we have pressing problem with our colleague, we able to resolve the solutions and also we verbalize our concerns. And through that, we able to maintain our team skills through collaborations and teamwork and also decision making. Through all this is will help us in problem solving and make us more disciplined and being cooperative person. So, firstly, specific training. First, here we encourage ourselves to further our study. For example, if we are diploma, we go for more further in our study like as a BSc, MSc, even doctorate. Or beside of that, we can choose for the post-basic training where we can involve ourselves, go for the 6-month course, 12-month course. For example, if you are in the basic diploma, we only learning a basic skills. But if you go deep basic training, we able to understand and familiarize what the subject about. So through this, we're able to gain a certifications. For example, NRCU nurse, midwifery nurse, and we got more detail in our nursing practice. So what benefits we will gain from this? We able to be remain focused in our career path. We also being able to have opportunities to seek new advancement or opportunities. Through this, the education process make us improve in our quality, give quality to our patients. For example, if you have knowledge and we have brush up on nursing skills, we able to understand people, even to understand what the subject in medical. For example, if you are in the unit, is coded happen. If you don't know what is coded, blue code activated, so we're not able to respond to the situations. So if we're not able to respond, we don't know how to treat our patients. So that's why being updated, being prioritized in the educations is very important to assist doctors, to assist and family members. For example, we able to verbalize patient consent and be a good team player. Secondly, conference and meeting. What are they? Conference and meeting is some kinds of networking or a meeting that is involving two-sided. For example, we are in Malaysia and those are in South Africans, in Saudi Arabia, we can exchange our opinion, and through this, we're able to advancing also in our career from across the nations. As we can see from the picture, there is Westerner and Malaysians. They are collaborating each other, exchange their opinion, and this is beneficial not only one part but both part as well. So benefit we gain from this time is giving a nice satisfactions. Why? Because we able to gaining a new knowledge, even a skills. And why we need this? Of course, again, for the patient satisfaction and clinical outcome, we have a compassion for our sick and effective in communication skill, meaning to say that we not only talking to our patient, but we are talking to our colleague. We are talking to all the members in the hospitals. So we need ability to think critically and adapt it in a correct manner. That's why if we are not able to practice all this in the well manner, we have a problem in stress situations. This stressful will give and also affect our nursing's uh, workplace. For example, when we don't know how to perform a simple basic life support, it will give stress to our nurse. So this emotional instability for the nurse. That's why if you go further in our skills, gain a new knowledge, is not also it's not just also give us time or certificate as paper, but it's giving us a soft skill, a new knowledge, which is can give impact to our clinical outcome. And online and CND webinar, what are they? This is a broad chosen part in nursing or even in any part of the country or even worldwide. What are they? They are designed for the nurses for the wide variety topic. For example, this is a topic that we can just anything regarding nursing, discovering multitude of topic, giving us update, even new policy that maybe if we are only informed policy through paper by unit, not everybody, all people can read about it or see it through by using online and CME, for example, and Zoom, Meet, Google, everything. That's all. It's very affordable. We no need to fly, air tickets, or even hotel to pay on, because it only sit in front of the desktop. It's on our fingertips, so it's very flexible and convenience. A very wide of topic courses we can touch off, and also improve nursing in their networking examples. Nurses not only touching our patients or handling us sick patients, but giving our nurses chances to improve in the soft soft skills also. For what the benefits of it, of course, it can be watched anyway. For example, nurses is working in the 12-hour shift. The courses is conducted the different hour. So it can be watched again because it's recorded. And secondly, nurses. I believe all the nurses in whatever country they are working with, they needed a CPD points to continue for the licensing. So by attending this webinar, for example, they will give us a chances to renew our licensure through the CPD awarded and also time and effectiveness, as I mentioned before. And beside of that, this is also giving a chance for the nurses for the learning comfortable. Why? Because they don't need to disturb their roster, no need to request for the changing time because this is 24/7. That's mean even the nurses after finish the duty, they can see the recording and then seek in a new career advancement through a variety of courses and also develop in their technical skill as well. So, in all, why nursing needed a continuing education? Because first of all, nurses may become from different specialty of area, from ER, from midwifery, even from NICU, PICU, whatsoever. But they are come in one as common. What are they? Skills, knowledge, and career advancements. Because nurse must be needs to be excellent in communications, not only for the patients but for the colleague, for the team players, for the doctors, even for the community themselves. And nurses must be initiative and must become all the time and needs to be competent. So in all of that, nurses require personal and professional development, not only through paper or hand practice, but soft skills as well. So to conclude my screen today, to conclude my topic, all what I learned today is nurses must collaborate, able be so problem solve, and also able must know how what the soft skill at the same times to become a more accountability in the workplace, so that able to engage in the high quality learning activities. Through these, nurses can be continuously growth and change, and the outcome and rewards from the consistent attentions will make nurse more collective in commitment and tremendous contribution in nursing practice for the best and excellent patient care. And for this, I took two reference from the Hamidi and also Kagar with the Friends 2020 from the Learning to Form Skill Based STEM, and also second one from the Chusai 2021 from the Journal of Nursing. I hope my presentation today will give a new informations, and also from today we're able to strive for our learning skills. Thank you.